Good morning, everyone. Today we are beginning our exploration of psychology, specifically how psychological principles apply to reproductive health practice. Although many people associate psychology only with mental illness, it is actually the scientific study of behavior and mental processes. Understanding how and why people act and think the way they do will directly strengthen your work as future reproductive health professionals. By the end of this introductory session, you should be able to 1. Define psychology in a meaningful way. 2. Distinguish between behavior, what we can see, and mental processes, what we cannot see. 3. Recognize the major subfields of psychology and how each contributes to health. These foundations are essential because every decision your clients make, whether about contraception, pregnancy care, or treatment adherence, has psychological influences. Psychology is not guesswork, and it is not based on personal opinion. It follows systematic and objective research methods designed to observe, measure, predict, and explain behavior. For example, when we study why some women refuse hospital births despite knowing the risks, we do not simply ask one person and draw conclusions. We design structured studies, control for bias, and analyze patterns across many individuals and contexts. This scientific grounding is what makes psychological knowledge trustworthy and applicable in clinical settings. When we talk about behavior, we mean any action that can be observed or measured. In a reproductive health clinic, behavior includes very practical things: whether a patient attends antenatal visits, whether a partner participates in counseling, whether a mother follows newborn care recommendations. Behavior is visible. We can track it, chart it, and evaluate it. Mental processes are different. They involve thoughts, feelings, expectations, fears, and motivations. These happen privately. You cannot directly see a woman's fear of childbirth or her internal conflict about abortion. But those thoughts may strongly influence her behavior. This distinction matters. For example, if a client refuses contraception, the behavior is visible, but the real reason may be fear of infertility, religious guilt, or distrust of health workers. Unless we appreciate internal processes, we risk misunderstanding our patients entirely. Psychology has 5 central goals. 1. Describe behavior. What is happening? For example, adolescents avoid facility-based delivery. 2. Understand causes. Why is it happening? For example, fear of judgment, financial barriers, peer influence. 3. Predict behavior. Under which conditions will this occur again? For example, prediction that stigma will lower clinic attendance. 4. Control or influence behavior. How can we shape healthier choices? For example, introducing youth-friendly services. 5. Improve human welfare. Ultimately, psychology supports better health, safer choices, and improved quality of life. Psychology is not one discipline. It is a family of specialties. Several are directly relevant to reproductive health. One is clinical and counseling psychology. It deals with mental disorders and emotional distress, crucial for supporting clients experiencing postpartum depression, trauma, or infertility-related anxiety. 2. Behavioral neuroscience studies how the brain and body influence behavior. Important when discussing hormonal influences on mood during pregnancy or postpartum. 3. Developmental psychology. examines behavior across the lifespan, from infancy through old age. It helps explain adolescent risk-taking or cognitive changes in pregnancy. 4. Social psychology focuses on how people behave in groups and how attitudes form. Essential for understanding stigma around contraception or abortion. 5. Personality psychology explores differences in traits and self-concept. Patients with high anxiety traits, for example, may require different counseling approaches. 6. Health psychology directly studies how psychological factors affect physical health. This field examines why people do or do not adhere to treatments and how stress affects reproductive outcomes. 7. Community psychology looks at social problems at the community level, including resource access, social norms, and resilience. 8. Educational and school psychology relevant when designing sexuality education programs or youth reproductive health initiatives. 9. Industrial and organizational psychology helps improve workplace well-being. For you, that includes understanding stress and burnout among midwives or ensuring safe working environments. 10. Environmental psychology studies how surroundings influence behavior. Consider how a crowded maternity ward or a lack of privacy affect women's willingness to seek care. Each field contributes a different lens, but all are useful when examining human behavior related to reproductive health choices. Closing remarks. Psychology is not separate from health. It is embedded within every health behavior. Whether we are trying to increase skilled birth attendance, support contraceptive uptake, or address gender-based violence, we must recognize that what people do is shaped by what they think, feel, and believe.